Hello to everyone and welcome to Mac Fitness. Today we're going to speak about lower back problems. The lower back, also called the lumbar region, is the area of the back that starts below the rib cage. Almost everyone has low back problem in some point of life. We have a different causes and kinds of lower back pain, but today we will speak and we will focus on the most common kinds of lower back problems, as well as we're gonna try to explain how to prevent this kind of problems and how to work out safe and help yourself or to your clients with this issue. Before we move further, let's say something about the basic anatomy and function of lower back. Lordotic curve is a natural inward curve called lordosis. In this area we have a lot of different muscles. Lordosis helping us to balance weight on the top of our head on the top of the spine, distribute weight from upper body to lower extremities, and reduce stress in lower spine. Lower spine contains 5 vertebrae labeled from L1 to L5. From the back side of vertebra we have the facet joints, which makes movements easier. L4, L5 and S1 carrying the most of weight of our body and doing the most of movements. Between vertebra we have intervertebral discs, jelly cushions, which giving support. The most often causes of lower back spine problem can be muscle or spinal strain, uncomfortable feeling of muscle spasm, which can be painful. We have a ruptured or bulging disc. When disc material starts to bulging and it's ruptured, that can put pressure on nerve, sciatica nerve, and then we can have acute pain. Also, we have a piriformis syndrome, very often problem with the lower back. Piriformis muscle is a deep muscle which is attached from one side on the peak of hip bone and from another side on glute bone. When this muscle is overtensed, gonna press sciatica nerve, which goes under, and we're gonna have a pain similar as we have when we have a bulge disc. So what can be a cause of overtense piriformis muscle? First, if we have a weak gluteus minimus and gluteus medius, we're gonna use much more piriformis muscle, and on that way that muscle can become overtensed. Or if you belong to 15% of world population who has this sciatica nerve through piriformis muscle instead under piriformis muscle, you will be more sensitive on this syndrome. So how we can help to someone who has this kind of problem? So first we can do soft tissue massage to make a pressure on a tensed place, and do stretching that's gonna reduce tension in this muscle. And from another side we can try to make a stronger and exercise our gluteus minimus and gluteus medius. So we would like to tell you which forces can affect your lower back spine. So we have compressive force, we have shear force, and we have torsion force. So compressive force is a vertical force, and this force occurs when we have a pressed vertebra from upper side, and then that can cause pressure on intervertebral disc and can cause a bulge disc. The best example for this is when we're standing in a very upright position and we have a weight directly over our spine. So when we're doing front squat, we're gonna have a higher compressive force than when we're doing back squat because of our body position. Shear force is horizontal force, and this force occurs when our vertebra want to slide from the vertebra below. The best example for this is when we are in bent over position. We're gonna have a higher shear force when we're doing conventional deadlifts than when we're doing sumo deadlifts because of our body position. Also, we have a torsion force. The best example for torsion force is one single arm cable row or single arm bolt row, and the more functional movements like movements in a golf. This force occurs when our vertebra want to rotate over vertebra below. Okay, let's say how we can protect our lower back spine and how we can prevent injuries. So as we said on the beginning of this video, our lower back spine contains natural inward curve. But what's gonna happen if we start losing that curve during some movements in a gym or in a daily life? First, let's see what is lower back flexion. So when we're doing in a gym deep squats and that butt wing, or in a daily life when we want to, for example, tie a shoe, we have a lower back flexion. Excessive lower back flexion can put pressure on our intervertebral disc and can cause a bulge disc. To some points of degree of flexion, our lower back muscle is going to help the spine, but then all weight will be directly only on spine. So excessive lower back flexion can also damage spinal ligaments. So also we have a lower back extension, especially when we have excessive extension or hyperextension, like in a yoga cobra position. We can put a lot of pressure on our facet joints and we can damage them. The most of serious injuries of lower back are cumulative injuries. That means we collecting these injuries during a longer period of time, usually. By some studies, we have our lower back spine can endure between 25 and 29,000 cycles of lower back flexions with moderate load. With the increasing of that load, these numbers are going to drop between 5,000 and 9,500. The worst combination for our lower back spine can be flexion or extension in a combination of some amount of compressive or shear force. The best examples for this are squats, deep squats with butt wing, or conventional deadlifts with a rounded back, or when we're doing hyperextension on a bench in a gym. From another side, we should avoid some rotational movements. One of the best examples for that are Russian twist with the weight, or lunges with a side rotation also with the weight. So what we can do to protect our lower back in a gym? First, we should learn how to perform exercises on a correct way. That's gonna reduce possibility of flexion and extension of our lower back, as we mentioned before. For example, when you're doing deadlifts and when you're doing deep squats. Also, right choice of exercises. We're gonna try to avoid some exercises. Also, as we mentioned, like Russian twist or lunges with a side rotation, and maybe we can think about that to change some exercises like crunches or sit-ups, where we have a lot of lower back flexion, with some other exercises like planks, which can be more safe for our lower back and also more effective for our abdominals. Then let's say something. Also how we can protect our lower back and how we can do safe workouts in a gym. We can use concept of progressive overload and give to our lower back muscles enough time to rest. Also, when we're doing some body parts like legs or back, we can use belt, which can create intra-abdominal compression, and on that way save our lower back spine. So let's say something about lower back mobility. As we said in the first part, one of the functions of our lower back is to transfer weight from upper body to lower extremity. Scientifically it's proved that higher mobility of lower back lead to injuries. So our proposal is to change some static stretching with some dynamic stretching like pose cow cat. Also, let's say something about non-gym silent killers of lower back. In some researches, we can find that one average person bend over 3,500 times during one day. We're doing that when we want to brush our teeth, when we want to take something from the floor, when we want to put the makeup, when we want to whatever you're doing during the day. And if we're doing that with a lower back flexion, that can produce cumulative injury of our lower back. So we will give you a couple examples. For example, when we're standing, let's say we have a compressive force on our lower back 100%. When we're laying down, that compressive force will be 35%. When we're sitting on a chair in a perfect position with a straight back, with the support for our lower back, that compressive force gonna increase on 130%. But if we're sitting like we usually sitting with the rounded back, with no support for lower back, that compressive force gonna increase on 180%. Okay, welcome back. We're gonna show you how you can discover do you have a problem with the bulging disc. We're gonna do a leg rise test. So Chris is gonna help us. We're gonna take a leg from affected side, and then we're gonna lift the leg up to 60 degrees, but around the 30 degrees. If test is positive, Chris is gonna feel pain in the lower back or glute area or high hamstring area. So even if I press his foot on this side, he's gonna feel higher pain if test is positive. So also we're gonna show you how you can discover, do you have a problem with piriformis syndrome. Now Chris is gonna lay on side. His affected side will be from upper side, and I'm gonna put his upper leg in 60-degree position. Yes, lower leg should be straight. Then with one arm I'm gonna block his pelvic bone, and with another one I'm gonna push his knee down. If test is positive, Chris is gonna feel pain in glute area. Thank you for watching.
We hope you enjoyed the video and you learned something from it.
Give us like
and leave some comments below.